The letter was sent to state legislative leaders as well as state officials in the Northam administration. And it's just the latest reiteration of Virginia Hospital's willingness to support the state as it continues to address challenges with respect to behavioral health treatment and behavioral health capacity and staffing issues that has led the some of the state-run hospitals to temporarily halt admissions. And so what we are essentially saying is that we're trying to make sure that there's a common understanding about the state of the behavioral health system in Virginia and what the data shows. And what the data shows is that our members, Virginia's private hospitals, continue year over year to handle the vast majority of both voluntary psychiatric admissions for treatment as well as involuntary. That would be patients who are committed for treatment under a temporary detention order. And so Virginia's hospitals, our members handle, the vast majority of these, thousands upon thousands, thousands more than the state-run hospitals are handling. And our members over the years have put forward a series of proposals to address some of the capacity challenges that's been experienced by state hospitals. And this is, as I said, a reiteration of that, but also just to make sure that we're all working from the same sheet of music, to make sure that there's a clear understanding as the General Assembly prepares to return to Richmond in early August for a special legislative session on a number of items, including how to allocate portions of the state budget surplus, as well as the $4+ billion in federal relief aid that the Commonwealth has. And there seems to be some conversation that new resources will be invested in behavioral health and mental health treatment in Virginia. And we have said to the state, we can help with that. But just as the state is experiencing staffing issues at its hospitals, our hospitals, which continue to deal with the COVID-19 pandemic, which has not gone away, also have staffing and resource challenges. And so we're ready to assist, we're ready to help, but that requires some support and some flexibility on the part of the state.